Hi, this is Charles Wiley from Columbia Theological Seminary, and today I'm here with Lisa Weaver, an assistant professor of worship here. How you doing, Lisa?
Hi, Charles. How are you today?
I'm okay. I hope you're staying safe during this difficult time.
I am, and I hope you are as well.
So one of the ways that Lisa and I have worked together in an odd way is that Lisa was teaching worship this spring, and part of that was teaching students about conducting funerals, services of witness to the resurrection. And she asked me to make her a coffin, a casket, kind of slightly reduced size, so that students could have a real life casket there when they're doing their practice of doing funerals. But the world of funerals has changed since I did that. How do you see as you reflect on the meaning and practice of funerals, how do you see the current changes in funeral practices affecting sort of Christian theology and practice?
The change that I see in practice is obvious because of the prohibitions that we have around gathering.
Right.
I don't think theology changes with context. I think the church and church leaders are challenged to think about how to still walk people, accompany people through the ritual, how to remind and reinforce them of the Christian theology of death and resurrection when funeral rites and rituals have been taken away, eliminated,
right,
truncated, have been changed in ways that impact their ability to grieve as they have been accustomed to.
Yeah, I talked to an older gentleman a couple weeks ago who had a number of friends who passed away in the last month or two, and he felt a real sense of loss of not having those rituals of gathering and grieving with other people.
Yeah. Well, and in this time, there are two losses, and he mourned the loss of not being able to grieve with community. What leaders in the church need to be attentive to is that in this season, grief is compounded. There is, if you will, a double kind of grief. There is the loss of the loved one, but there's also the loss of the ritual grieving. And if we want to make a sub point on that or make it a separate point, the third thing is that they are grieving the ability of being with the community who comforts them and walks with them and witnesses to and with them in the ritual. So grief is compounded in this season. And my hope is that he has a community, a pastor, a faith leader, a clinician, a spiritual director who can help him move through the grief.
What do you see? There's so many people who are dying alone, or dying at least with very limited contact, perhaps just with medical professionals around them. How does the church, what's the church's role in a time like this?
The church's role has not changed. It is still to be present for those who are dying, to accompany the dying, and it is also to be with those who are left behind to mourn and remember their loved ones. So that hasn't changed. How we do it is changed. And thank you for saying that, because so many people think that, or say or ask, well, how has this changed? We are still Christians.
Right.
Our theology has not changed, and we are still human. So our natural human response to loss has not changed. The challenge for the church, as with every other institution, but particularly the church, is how are we functioning as the church in times where our parameters have been greatly changed. And so we still have to show up and be the church. One of the things I think theologically that it causes us to lean into is what it means to be the priesthood of all believers. And we've been having longer conversations about the priesthood of believers, authority, ecclesial faculty, who normally would do X. Well, we're not in our pre-pandemic context. And so now we have to think about how we become present, are present. For example, nurses and medical professionals and doctors are using FaceTime for patients and their families. I
Right.
had a conversation with someone recently. He's a chaplain, and he and his team, like every other chaplaincy team, is working overtime. And we had the conversation, and I said to him, he said, I can't go in the room. He said, so I can't do bedside ministry. I said, well, let's think about this creatively. If our ritual, if our bedside rituals include prayer and laying on of hands, right, and speaking,
Right.
what would it look like if you can't go in, if you have to stand outside the room, or if you're fortunate enough to be in a medical institution where they have speakers on the door so you can speak in? I said, what would it mean for you to have the healthcare workers lay hands on that person as you pray and they hear
Oh,
you,
uh-huh.
right? You can't be there to lay hands on them. There's certain things you can't, prescriptions that you can't come close to them, but we have to think of how do we creatively still
Right.
make it to the person who is being impacted, to the patient, and subsequently when that patient passes on to the family members as well. And so we need to think creatively about how we engage and utilize the people around us
Right.
who are also doing ministry, right? Because I mean, I consider healthcare workers to be doing ministry.
Right. Right. That's a real, that's a really interesting suggestion you had there about, uh, that's just really interesting to me. Now, I know that your home church has really been hit hard by COVID-19 with a large number of people passing away from it. How has that affected you, or what have you been thinking about as you've heard these terrible reports?
It's been difficult. It's actually been very difficult because we have a congregation. My home congregation is one that families have gone to for generations.
Right.
So 3 and 4 generations of people, of families, attend this church. And so some of the people who have passed, because that's my home church for decades, that church family has been part of very key moments in my own life and journey, not just as a Christian, but also as an ordained clergy person. People
Right.
who were there when I was ordained, people who participated in my ordination, people with whom I've done ministry here in the United States and internationally. And so people with whom I broke bread, people whose children I had in Sunday school and whose grandchildren I dedicated. So it's been difficult, and it's been hard to be away from home. But
Right.
technology has been helpful. We've had conference calls with prayer. We've had events on FaceTime, Facebook rather. We've had Facebook devotionals by some of the ministers at the church. So those things have been helpful to feel connected to home. But my last count has been 16 members of my congregation have passed.
Wow.
And so it's been halting.
Right.
Lack of a better adjective, it's been halting.
Well, just before 10 minutes before we started this Zoom call, I saw a headline of a Atlanta news station saying that 80% of the people hospitalized for COVID-19 in Georgia are African American. And that seems to point to some really deeper realities of who we are as a people, that that this virus is affecting African Americans quite inordinately.
Yeah. What that points to, and thank you for raising that, people of color, minoritized people, African Americans, Black and brown people in this country, poor people, there are demographics of people who are consistently and systemically disproportionately affected by adverse conditions.
Right.
Pre-pandemic. This pandemic has not, and the virus has not and does not have a particularity or a predisposition toward those demographic communities. Rather, the pandemic exposes and brings kind of in relief disparities that have already existed in our system.
Right.
And so there are minimally two things that need to be addressed. Certainly the pandemic itself, we have to save as many lives as possible. And while we're doing that, alongside doing that, we have to also address the systemic disparities that create these numbers. And so that's a policy issue, but it's also a gospel issue.
Tell me more about what you mean by it's a gospel issue.
Because all human beings are created in the image of God. No life is more or less valuable than any other life, male, female, black, white, straight, gay, lesbian, transgender, American, someone who's not born here. All lives, all human beings are created in the image of God, period, full stop. And when policies and systems and structures exist where the recognition of everyone's humanity is not regarded equally, that's a policy issue, and that's a gospel issue.
Yeah, okay, gotcha.
That's an absolute gospel issue.
That's really helpful. Thanks. So, as you've been thinking about our discussion and today and preparing for it, are there things that you were thinking that were really important that we haven't gotten to?
I think there are a couple of things.
Okay.
One of the things that is a particular concern, and not just as it relates to death and grief and loss, I think large, if we think in a broader way, we have to think about the long-term effects of the pandemic. And people who lose people who have lost loved ones as a result, certainly there is a particular kind of contextualized grief around the loss of that person. But also, all of us are feeling the long-term, are feeling effects that will endure beyond this around the situation. This has been disorienting on varying levels, but for everyone, it's been a disruption. And so the grief of not just loved ones, but if we think even of quotidian activities, of going out to the grocery store, going to our jobs, serendipitous conversations we have with colleagues and students in our content. Right. All of that has been disrupted, and there is a disorientation that accompanies that often it manifests as grief. There's a certain amount of grief that we're all carrying now, and to be attentive to that grief, to be attentive to healthy ways of working it out, if we're not careful, we will begin to engage in behaviors that look like we're doing fine. We will become obsessive or compulsive about, cleaning and order and ritual, when it's exhausting to do this in different modalities. I'm concerned that we are attentive to how children manage disruption.
Oh, right.
And grief, as they are home with us and are as Zoom fatigued as we are. So about managing those kinds of grief, I'm really concerned about the management of grief and people's mental health around this. And also with that, to be careful, or to handle carefully, managing mental health and spirituality. The questions of theodicy that arise around where is God, why has God, fill in the blank, and to attend to those as entities in and of themselves, and to attend to those as they impact people's mental health.
Right.
And their faith and their confidence and their securities, and inform their fears. We have to be careful to gingerly handle and steward those matters with the people who are in our care and charge.
Wow, that's really helpful. Well, this has been a really great conversation. You're a very thoughtful person, and I appreciate you taking some time to talk. We'll post this soon, and I look forward to seeing you in person someday.
Charles, thank you so much for the opportunity to just share and be in conversation. Blessings to you.